So Al, when did the pet therapy program first start?
I don't know the exact date, but it was well before I got here, about 2008 was when they started their first dog, and it wasn't a children's hospital, it was not an adult hospital.
And what is the difference between the standard typical pet therapy programs and the one here at MUSC?
The real difference is that most of your clinical environments, not all, but most, there are a number of them throughout the United States that do what we're doing, but most of them are more of a meet and greet. They go to the visitors area, the waiting areas, okay? They don't interact with the patients personally in a very difficult environment, meaning the intensive care units. So we do work in the intensive care units. The dogs do get on the bed. And obviously, the dogs that work in that environment, we need dogs that are very well trained and controllable. We don't have all our dogs, and we do have 47 teams that get on the bed. For instance, we did have a Great Dane here that weighed 156 pounds, and that's a little bit difficult to get that dog on a bed with a patient that's in intensive care. But I could see dogs in a range of 80 pounds getting on a general population bed, and up to around 60, 65 pounds getting into a bed with an intensive care patient, depending on the circumstances.
And would you say that the program has been received well by the patients?
Based on the letters that we've been getting in, especially to the administration, yes. And that's one of the reasons why they are expanding the program. That's one of the reasons why I'm employed by the hospital. They've made an investment here by hiring me, because it was very well received by patients, okay? And not just patients, but patients, families, and staff. I mean, there's going to be a debate that's going to go on for a long time, whether the dogs are here for staff or they're here for patients. Obviously, they're here for the patients, but the staff benefits from it also.
And for people who are interested in perhaps having their dog participate in a program such as this, can you tell us a little bit about the selection process?
Well, the selection process, for the most part, takes place outside the hospital. We accept dogs from 3 national registries, meaning 3 therapy dog registries. One would be Therapy Dogs International, Alliance of Therapy Dogs, and Pet Partners. The most prevalent one down here in the Charleston area is Alliance for Therapy Dogs, but we do have people coming in here, moving in from other areas of the country, and we do accept those. Those are 3 national organizations, by the way. There are some local organizations, but we do not have them on an acceptable list right now. Once they decide that they have a registered therapy dog, that does not preclude the fact that they're just going to come in here and bring their dog in, and it's going to work in MUSC. First, you have to become a volunteer, and that's for the human part of it. And then from the canine part of it, I will be looking at these dogs to see if they're an appropriate match with the dog and the handler, meaning, of course, the team. Because this is not just about the dog, it's not just about the handler, it's about them working together. And some therapy dogs are more appropriate for working in nursing homes, working in the READ program, and may not be appropriate working here in a clinical environment. But we do have a high percentage of dogs that do get through this procedure, and they are very well received here. Although they work in different areas of the hospital, depends on their size, their disposition, and what have you, especially the handlers.